Yesterday, thanks to the information being released by the Florida Hospital Association, the U.S. Department of Health and Human Services reported that Florida hospitalization rose once again to an all-time high of 11,515 patients. Even more troubling, of those patients, 2,400 are in ICU. And just a reminder that this doesn't just impact COVID patients, but others who need non-COVID emergency care and are finding hospitals near capacity. For example, AdventHealth returned to black status, deferring non-emergency surgeries at hospitals to only conduct urgent procedures. We finally also saw updated numbers yesterday on the CDC COVID data tracker, LATE, which depends on the Florida Department of Health providing those numbers. From Saturday, July 31st through Monday, August 2nd, the state reported 50,997 new COVID cases. That's roughly 17,000 new cases every single day for 3 straight days. For comparison, just 1 month ago on July 4th, Florida was averaging 2,300 cases per day. In the same 3-day period, Florida also reported an additional 100 deaths. 100 more lives that were lost here in our state. Even just 1 death would have been too many because every life is precious. And because it didn't have to be this bad. We have the way out of this public health crisis. Go get the vaccine. I am urging our governor, prioritize vaccine education because that is the only way that we are going to beat this virus. I've also requested that he declare a state of emergency to provide much needed state and federal resources to coordinate to combat the spread of the virus. And I've been in constant communication and continue to call on the governor and the Florida Department of Health to resume daily COVID-19 updates. The people of Florida should not have to wait 3 days to receive new COVID reports from the state after Friday's all-time record high number of cases that were reported. This would be like a hurricane, which we all live in the state of Florida. When a hurricane, we know the hurricane season, we know how to prepare. And we know that when a hurricane is coming, we are every single day watching the weather station, watching all of the different reports coming out of the Emergency Management Center. We are hearing where the cone is coming. We are seeing the severity. And when there is in fact an evacuation ordered, we know where to go, how to get out of our homes, and where any of the locations for evacuation sites might be. Can you imagine if we are in the middle of a hurricane season and we tell you a hurricane is coming, and that's all we tell you? Not give us any updated information, not doing anything to protect ourselves, our families, and our homes. But that is exactly what is happening here in the state of Florida, and we are vulnerable without this information. That never should have happened, but it is what is happening here today. Just looking at the CDC's weekly state profile report that was updated yesterday, we are seeing an increased rate of new COVID-19 cases of 53% in Florida and an increase of 56% when it comes to hospital admissions. With the troubling and delayed numbers we've seen since Friday, I hate to imagine what our numbers will show next week. It is critical that we do more to get Floridians vaccinated and keep our community safe. From wearing masks when you're indoor in public, or having real conversations with anyone you know who isn't vaccinated on their safety and efficiency. Help them find convenient vaccination sites by reaching out to Florida Department of Health. And I will continue to share information every day to remind Floridians this virus is real. This is a crisis as we speak. The numbers are real. The lives COVID has taken were real. And the solution is real. Go get vaccinated. And this is also why it is so important that this governor calls for a state of emergency. This allows us to have more pop-up sites and pull down federal resources both for testing as well as for vaccinations. As I speak to people all over the state of Florida, talking to nurses and doctors and hospitals who are at capacity, I was talking to a colleague up in Duval County who said there's only 2 free testing sites in all of Duval, and it's a 2.5 hour wait in this Florida summer heat. And they're having to call ambulances because of heat stroke. We know how to get through this, Florida. Go get tested if you don't feel well, get the vaccines, mask up, social distance, wash your hands, and be smart. The tools are in our shed of how to move forward and get past this virus. Please, I implore you to listen to the scientists and to the medical doctors, and we will get through this together. As long as we put our best foot forward, we come together, but there is hope. We have seen also an increase in the amount of Floridians who have been listening to our messages and have gone out and gotten more vaccines. We've seen a significant increase. Keep doing that. That is the only way that we are going to save lives, save our economy, save our healthcare system. And again, if you're not going to do it for yourself, do it for your parents, your grandparents, your kids, to the first responders who now for a year and a half have been at the front line of this virus. Do it for them. Do it for our communities. Go back to some of the 10 commandments, that you're supposed to, be a good neighbor. That's what we need to be doing today, is working together to get in front of this virus. Thank you. I'll take any questions.
Yeah, so seeing your first push by Governor DeSantis, do you think that was the right move? And if you were to...
Seeing the first?
The senior first.
Oh, senior first, okay.
Yeah. Seeing that push by Governor DeSantis, do you believe that was the right move? And if you were to roll out your own COVID response, how would you do things differently?
Well, first of all, we should have been prioritizing not just our seniors, but also our first responders. We knew between our first responders should have been at the front of the list. Our medical professionals, our doctors, our teachers should have been there. Our essential workers like our ag community, the ones that have to go out into the workforce. And unfortunately, those were never prioritized, a good chunk of those individuals. And unfortunately, when the governor put seniors first, he then stopped talking. And while we have a significant senior population, it still only assumes there's still a large chunk of our population that was never messaged to. So once the seniors were vaccinated, and unfortunately, people that were close to him who got to the front of the lines, he stopped talking about it and believed that COVID was no longer an issue for him, was going and starting to talk, going to Texas and going to the border and talking about the, a perceived, crisis at the border, traveling across our country, doing fundraising for 2024. And he stopped talking about COVID. And now what he's done is he's hamstrung not only our local governments, our businesses, who were the ones, both the local governments and our businesses that stood up to him last year and did what was right for their communities. They're not able to do that today. Look at our school boards, who all they're trying to do is protect their students and the people that are in our school system. And unfortunately, so not only has he no longer started talking about COVID, he is masking around and walking around with anti-vaxxers and anti-maskers and sending the wrong message to the people of our state. This is serious. We are in a crisis. Everybody needs to do their part, and unfortunately, the governor is not doing his.